Hello, everyone. Welcome to the McMaster Health Forum here in Hamilton, Ontario for our latest Queen Elizabeth Scholarship presentations. I will walk you through a little bit about the forum and the scholarship program, and then I'll introduce you to our scholarship presenters for today, Adam and Navi, and then we'll end with some questions once they're both completed. So the McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders and act as an agent of change by empowering stakeholders. Our Queen Elizabeth Scholarship Program has existed in two different forms. The original Queen Elizabeth Scholarship Program was in strengthening health systems, and our latest one is strengthening health systems, health and social systems. The Queen Elizabeth Scholarship Program is managed through a partnership between Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and individual Canadian universities. And the purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges, encompassing international education, discovery and inquiry, and professional experiences. As I noted, this is our second Queen Elizabeth Scholarship program. We are one of 20 universities to have been awarded this second program. The purpose of the program, or the focus, is strengthening health and social systems. Our original program, which was on strengthening health systems, engaged 14 incoming scholars, 3 outgoing scholars, and 44 outgoing interns. So we had quite a busy time in those 4 years of that original program. Our recent program on strengthening health and social systems has so far engaged 7 incoming scholars and 13 outgoing interns. There are no outgoing scholars in this current program. The photo on the screen there, if you're interested, is some of our current scholars at an event at Queen's Park with the former Governor General, David Johnston, and the current Lieutenant Governor of Ontario. All right, our presenter today is Navi, who is a graduate student in the Master of Public Health program at McMaster. Navi's master's thesis explores how a culture of hegemonic masculinity influences public safety personnel's uptake of a mobile health approach to peer support. During her internship, Navi aimed to understand how public health organizations are bridging the knowledge translation gap in the Australian context. So, Navi, over to you.
Okay, thanks, James. Hopefully everyone can hear me. Hi, everyone. So thanks to everyone who's joining us today in person and online. My name is Navi. My pronouns are she, her. And for the next 20 minutes or so, I'll be presenting my experience as a QE scholar at the University of Newcastle's School of Medicine and Public Health. All right, so this is just a roadmap of what I'll be touching on today. So I'll start with a bit of an introduction, just a little bit about myself and how I sort of came to applying to QES. I'll get into the University of Newcastle and what their research focuses on, why I eventually decided, I want to do it. I want to go to U of N, let's do it. The projects I worked on while I was there and everything that I learned, both academically and just through my adventures and by virtue of being in Australia. So I just wanted to start by introducing my academic background because I think it can be helpful to sort of understand the experiences that eventually led me here. So I actually finished my undergrad in 2020 at the University of Toronto, where I studied physiology and global health. And so that global health piece is really where my interest in understanding health in its larger social, political, cultural, et cetera, context sort of came from. And funnily enough, QES was actually being offered at U of T at the time, but I just, for whatever reason, never really got around to applying to it. And so I was really, really excited when I started grad school in 2021 at MAC as a Master of Public Health student. And I saw that the forum was actually offering QES. And so it felt like a no-brainer to me to apply. And if there are any MPH students in the audience, I was actually able to use QES as my practicum experience. So if that's something you're thinking about, that's something that's definitely possible. And so in my application, I had indicated that I was interested in going to Australia. And that's sort of where the University of Newcastle comes into play. Because U of N is an academic institution, it has like a variety of researchers who are doing a lot of different research in a lot of different areas. And so for me, I was working with Dr. Luke Wolfenden. He was the main PI I was working with. And his lab focuses a lot on chronic disease prevention in a public health setting. So when I'm talking about the projects I worked on, they all revolved around chronic disease. So that's a bit about the projects that were presented to me. And so it was sort of, there we go. It was sort of an interesting time because we were still in the middle of COVID, or sort of towards the end of it, I guess. I don't really know where we are with all of it at this point. But so I didn't really know if I would be able to go, or if I eventually would decide to go, but I did. And so there was a lot of factors that led to my decision. The first was this desire to travel, especially on my own. So I felt like this would really develop my assertiveness, my problem solving, and leadership, which, is applicable to any line of work, but really just as a human being was something I wanted to grow. I was interested in the opportunity to network globally. I thought that was really an interesting idea because I don't really know where I'll end up. So that seemed cool to me. So like James mentioned, I'm a thesis student right now in the MPH program. And so I love research. And so I really liked that the internship was more research-based and would be focusing on those studies. And then I really liked that we'd be receiving forum training. And the projects that were presented to me focused on evidence synthesis and knowledge translation. So I had previous experience with evidence synthesis, but knowledge translation was something that was completely new to me and not something I had previously worked on before. And so I like the idea of engaging in research that was outside of what I would traditionally be interested in, and just exploring a new research area. And so I was like, let's do it. I packed my bags. And I'm actually from Vancouver. So my flight out to Sydney was from Vancouver. So it was about 14 hours. It was a lot longer coming back to Toronto. And I landed in Sydney. And then I took a train, which was about 3 hours, up to Newcastle, where I was met by my supervisor. And that was where I'd be for the next 3 months. And so the middle picture there is just Navi's beach and Navi's lighthouse in Newcastle, which I just thought was a pretty picture. So I thought I'd include it. And that is Glen Rock, which was one of the areas I did a hike in Newcastle. And so while I was in Newcastle, there were a variety of different projects I kind of got to dip my toes into. And so I'll briefly summarize the first two and really get into the third one. It was because that was the one that I was really working quite a bit on. And so the first was a scoping review of factors associated with adolescent e-cigarette use. This project was being led by a postdoc researcher, Courtney Barnes. And I think the idea here was that we wanted to understand the upstream pathways that really lead to adolescent e-cigarette use. And that's really the first step before we can start to create public health programs that focus on prevention and work to actively mitigate these pathways. It was my first time actually working on a scoping review, so I'd never been involved in a project that was quite that large. So it was kind of crazy seeing how many papers we were coming across. And so here I really participated in screening and title and abstract screening. And that was sort of my role in this project. The second was a systematic review of barriers and facilitators to dissemination of non-communicable disease research. And that this project was being led by a PhD candidate, Anna. And Anna was great. She was really, really fun to work with. Shout out to Anna. So this was a really interesting project because I didn't quite understand the nuance between dissemination of research as well as implementation. I think often those two words can be conflated to mean the same thing, but I learned that it actually isn't. And it was really difficult to work on this review because a lot of authors also use those terms interchangeably. And so we were really interested in understanding from the researcher's perspective, what are some things that prevent them from doing that sort of active distribution of their research. So is it funding? Is it support? That sort of thing. So that was the systematic review I worked on. Here I was able to do a little bit more. So I did title, abstract, and full text screening. I was also involved in critically appraising the studies that we eventually included. And then I also did some data extraction. So I got to see this one a bit more like from the beginning to the end. And then the third one that I'll talk about more in depth, which was just a really interesting project as well, super confusing, but was a RCT investigating strategies that can be applied to KT products to increase their use by public health policymakers and practitioners. So this project was being led by a researcher named Serene Young. Serene was also really awesome to work with. So the researchers were interested in understanding how, if you take so when we generate research as researchers, we want to be able to then translate that evidence to policymakers and decision makers. And so Serene was interested in understanding how, if we had an evidence summary, for example, of research that we had generated, how, if we sort of tweak the source of this evidence summary or the message of the summary, how that would then influence policymakers and practitioners' intention to adopt, as well as their extent of use of this summary. So it was really focusing a lot on like communication science as well as media. And so we were thinking about how to really manipulate familiarity and credibility as well as professional pressure. And then how we could also manipulate the actionability of the summary as well as its relevance and desirability. So sort of just thinking through how we would do that was really interesting to me. And so, like I mentioned, the rationale for this is really bridging the knowledge translation gap and really trying to understand our audience and what sort of will make them more likely to use this evidence and to refer to it, because that's ultimately what we want. And so the participants were public health policymakers and practitioners. The scope was Australia, so it was throughout Australia, and then the evidence summary that was going to be distributed focused on evidence and community-based obesity prevention programs. So in terms of my role, so just a disclaimer, this picture is me working on my thesis. It's not the actual study because I can't share that data, but I was involved with designing the surveys that we would be submitting to ethics for this study. So that involved a thorough literature review to understand what sort of was out there in terms of different scales and questionnaires we could use to measure those different variables I talked about, like familiarity and credibility, which was challenging because these are really like abstract concepts that were sort of being measured in a lot of different ways. And so it involved a lot of back and forth with my supervisors and sort of trying to make sure we really narrowed down on what we were trying to measure and that we were measuring it out accurately. I was also involved with registering this trial with the Australia and New Zealand Clinical Trial Registry, as well as developing the baseline knowledge translation product. So developing what I thought a baseline evidence summary without all those different manipulations would look like. Okay, so that's sort of a bit about the academic, and this is more of, academia is really fun, but this is more of like the fun part of our programming in terms of Australia. So I sort of made it a priority before going that I really did want to travel a lot on the weekends and maybe take a bit of time off whenever I could, just to be able to explore the country a bit. Australia is one of those places that feels really hard to reach, probably because it is. And so I really wanted to make the most of it while I was there. So I was really grateful and lucky enough to be able to do some traveling with money I'd set aside for grad trip, which I wasn't able to do because of COVID. And so I visited all around. So I visited Sydney. A highlight was definitely watching a show in the Sydney Opera House. I visited Byron Bay. And I think, so yeah, I think Byron Bay is like the most eastern point of Australia. So that was cool. This hike was really, really beautiful. I'm referring to the middle picture here. Lots of bug spray, but really beautiful. And then the last picture over here, I took from the Q1 building in the Gold Coast. And it's just like super, super beautiful. Like all of the beaches on Australia, I don't have any words to describe. Really, really pretty. The coast just goes on forever and ever. So really, really, really pretty stuff. And then so this sort of occurred to me while I was in Australia. I was like, wait, the Great Barrier Reef is here. I should probably go. Obviously in a way that is sustainable and doesn't harm the reef itself. I say we here because I was able to meet up with one of our other QES scholars who is in Sydney, Seth. He and I did some research and found this company that was ecotourism certified. And then we went and did a glass bottom boat tour of the reef, which was really cool. And it was just like super amazing to learn about the biodiversity that the reef supports. And kind of made me really stressed about climate change as well. But that's okay. It's not okay, but and then it was also super interesting to learn about the reef and the impact it's had on Indigenous communities and how Indigenous communities in the region have sort of used the reef and taken care of it like for forever. And so I believe it's the Kuku-Yulanji people that we were learning about when we went on this tour. And then the second picture here is the Daintree Rainforest, which is part of the largest continuous area of tropical rainforest in Australia. This is also the traditional lands of the Kuku-Yulanji people. So that was really just like obviously super, super pretty, and like felt very grateful to be able to spend time in like the Australian bush. And then the last place I was able to visit was Melbourne. This was really, I think this was like the weekend before I left, actually. So a super quick trip to Melbourne. And Melbourne has a super cool arts and culture scene. This is the Royal Exhibition building. And they have great coffee, and I caught a show while I was there. I think it was, Harry Potter and the Cursed Child. So that was really cool. And so, I had a lot of fun learning about Australia and like exploring the country while I was there. And so this was probably the hardest slide for me to make because there's just so much I did learn. But academically, I got to gain an understanding of public health in international settings, which was pretty cool, really understanding how public health operates in Australia and how the University of Newcastle sort of is affiliated with the local health district, learning more about knowledge translation, the importance of surveys as research methods or as tools to collect data, really developed my evidence synthesis methods, and then my understanding of Australian culture. It was just like a lot of fun to interact with my roommate and have moments when we were like, what are you saying? I really don't understand, going both ways. And just learning about the culture and like, really just like, it was super exciting. Like even just going to the grocery store was such a thing, like, because everything is so different. So I really enjoyed like being immersed in the culture for this 3 months that I was able to develop my communication skills as well as like just my confidence and problem solving. I think traveling alone really does that for you. So I really, really encourage people to travel alone, to apply to QES. It's a lot of fun. And I guess I'll end it off with questions or turn it back over to James.